Good morning friends, welcome to my channel Photographic Memory. So today we will be talking about submandibular salivary gland, its anatomy, its nerve supply and venous supply, its boundaries and everything. So as you can see in this diagram, the blue portion is the salivary gland. This is the actual location of the salivary gland. It is located in the anterior part of the digastric triangle. Now this salivary gland is about 15 to 20 grams in weight and has a salivary duct which is called as the Wharton's duct. Show you the exact location of Wharton's duct in the upcoming diagrams. Okay, so this salivary gland is basically covered by two layers of deep cervical fascia. Now this cervical fascia is divided into two layers, that is the deep and the superficial layer. Now as we go to this diagram, as you can see, this is the submandibular salivary gland and this is the sublingual gland. Okay, these are the ducts of the sublingual gland, whereas this is the duct of the submandibular gland. Now as you can see in this diagram, the mylohyoid muscle is the muscle which divides this submandibular gland into two parts, that is the superficial part and the deeper part. Okay, we'll be talking about the boundaries of the superficial and the deeper part ahead in this video. Okay, now as you can appreciate in this diagram, this gland is laterally enclosed by the mandible. As I told you before, that this gland is divided into a deeper part and the superficial part. Okay, so the superficial part is the part that fills the digastric triangle. It extends superiorly deep to the mandible and inferiorly up to the stylohyoid muscle and the digastric muscle. Inferiorly, as you can see, will be skin, platysma, cervical branch of the facial nerve, deep fascia, facial vein and submandibular lymph nodes. Okay, so this part of the salivary gland, which is the superficial part of the submandibular gland, is covered by skin, platysma, cervical branch of the facial nerve, deep fascia, facial vein, and submandibular lymph nodes from the inferior surface, whereas laterally it is covered by submandibular fossa on the mandible, insertion of the medial pterygoid and the facial artery, and medially it is covered by mylohyoid, hyoglossus, styloglossus muscle. As I'll show you in the next diagram. Okay, just make a note of this, that superficial and the deep part is divided by the mylohyoid muscle, as you can see in this diagram. Okay, now the diagram below will show you the medial and the lateral, and also the inferior surface. As you can appreciate this diagram, the superficial part of the submandibular gland is laterally covered by the submandibular fossa on the mandible. The insertion of the medial pterygoid muscle, as you can appreciate in this diagram, and the facial artery. Facial artery you can appreciate in the upcoming diagrams. Okay, so just have a look once. Okay, now even in this diagram you can appreciate the fascia, which is splitting into two, the deep and the superficial fascia. Okay, this is made up of the deep cervical fascia. Inferior surface of the superficial part of the submandibular gland can be well appreciated over here. This is the skin, the platysma, and the cervical branch of the facial nerve will be appreciated in the upcoming diagrams, even the facial vein. Okay, so let's go on to our next diagram. You notice the lateral and the inferior portion in the upper diagram. In this diagram, you can appreciate the medial portion. So medially to this superficial part is your mylohyoid muscle, the anterior belly of the digastric, also the hyoglossus and the genioglossus, and even the styloglossus, which I showed you in the first diagram. Okay, second, medial to the deeper part of your salivary gland is the hyoglossus muscle and the genioglossus. whereas laterally we have the mylohyoid muscle. This Wharton's duct, as you can see over here, this is the salivary duct of submandibular gland. It is thin walled and it is 5 centimeters long. Okay, it emerges from the anterior end of the deeper part of the gland and runs forward onto the hyoglossus muscle between the lingual and the hypoglossal nerves. Okay, now if we see the horizontal section of this gland, now let's go on to the blood supply and the nervous supply of this gland. Now there are three main components in this diagram to be noted. First is the artery, that is the facial artery. It is tortuous and gives us a S-shaped bend with two loops. Okay, this facial artery is palpable on the base of the mandible at the anterior inferior part of the masseter muscle. So this facial artery arises from the external carotid artery just above the tip of the greater cornea of the bone. Okay, you can appreciate in this diagram. Okay, these are the 2-3 diagrams which you need to learn. Make a note in your notes. Okay, aspect of submandibular salivary gland will be just in the upcoming video. If you have any doubts, please be free to post it in the comment section below, that I can solve those and also have a video about that.